Good afternoon, ladies and gentlemen. Welcome to Live Talk with Dr. Moby. And today we are fortunate to have great Dr. Bisma Baig with us. Let's welcome Dr. Bisma.
Hello, hi, how are you?
Good, good. Nice to meet you.
Likewise, and thank you for having me here in studio.
And also, I just want to tell that Dr. Bisma Baig is actually from same medical college as I graduated.
Oh, yes.
So
Small world.
Yes, small world. I was so fortunate to have her as a guest today. So let's learn from her. Dr. Bisma Baig, tell me about yourself.
Okay, so I don't know where to start, but anyhow, as Dr. Mubashir said, or Dr. Moby, he said that we are from the same medical college, so Untitled Medical College from Lahore. And then after that, I'll start from America. I am an MD, and actually before coming to US, I have worked as OBGYN. I'm a former OBGYN, so I have women's health, improving women's health is my passion. And when I moved to US like 2 decades ago, I wanted to focus on women's health. I wanted to continue to focus. So in that regards, I did my clinical MD, and then afterwards I wanted to do something on a bigger level. I transitioned to practicing as public health person, public health consultant, public health specialist. So for that, I went to Johns Hopkins Bloomberg School of Public Health, and I specialized or concentrated in women's health. Besides that, I was also fortunate enough to have a chance to finish or to get admission into graduate level certificate. The idea was that I will focus on international women's health. So since I belong to Pakistan, Asian women, their health is very close to my heart, and I know women go through a lot. So I wanted to collaborate my clinical experience with the public health so that we could make policies and treat the patient not individually but on a mass level as a population health. So MPH, I finished my MPH focusing in women's health, and since then I have been involved with the various projects at a local level. Baltimore City Health Department, I have worked with Baltimore City Health Department, and also currently I'm working with the state of Maryland in order to fulfill my dream, my passion to help underserved women. So my projects, I'm involved in various projects, and various projects they are helping women, helping improve women's health through different channels.
Okay. Well, that's a great intro. And also I like to kind of know some of your passions. I think you have mentioned about women's health, and that is so dear, especially here also and also back home. A lot of women actually, they are actually not educated about their health.
Exactly.
So, and I think good thing is you have done OBGYN, and you know that they mostly are only working to actually produce babies.
Yeah, that's true.
So,
unfortunately, that's true. Yes.
And then they don't take care of their own health.
Exactly.
And somehow I have seen them really suffering from a lot of these simple things.
Right. Simple things.
Yeah, which I think anybody should have taken care. So there are few risk factors. We'll discuss one by one. One is the biggest one is, and the easiest to fix, is osteoporosis. I will talk a little bit more. So tell me what when you were doing OBGYN, what was your experience with the prenatal care in Pakistan?
So it's a very, very vital topic actually, the one we will be just discussing now. Vitamin D, as we would say that I would try to discuss today one, as we said, and we will be continuing this talk because that's how I came to launch my own channel. I have a YouTube channel, Facebook channel, and all these digital media platforms where I am trying to promote health. So what I would like to focus on is vitamin D and calcium, how important these things are, because even in Pakistan, even in India, Nepal, Bangladesh, every part of Asia, rather every part of world, even in US, when I started my residency here, clinical residency in family medicine, I saw that, oh my God, vitamin D is really, really deficient at various biological stages of women. Yeah. And by that I mean vitamin D is so important that it is not a vitamin even, it is a pro-hormone. So medical research has focused a lot, and there has been various studies which have proved the significant role of vitamin D and what it can do to our bodies, how many, a variety of deficiencies and side effects it can produce. So I'll start like if vitamin D is deficient in childhood, and we'll talk about men and women here, kids. If it is deficient, kids can have weak bones, they can have easy fractures, their bones, and they can have lots of bone pains, and sometimes these bone pains, they are confused with the growing pains. And when you go to doctor, my personal experience, and I would like to say my daughter, my own child, we will go to pediatrician, and I was a doctor of course, and I would tell my pediatrician that my daughter is having lots of restlessness at night. She was like 5-6 year old or even younger, and everybody would tell me, even her pediatrician told me that she's going through growing pains, and this is very normal. But believe me, I insisted that her vitamin D level needs to be checked, and it was over 10 years ago, and her vitamin D was extremely low, and that made me think, oh my God, what? And then that prompted for my own testing, and when my testing was done, my vitamin D was below 30. I mean, can you imagine a doctor and her vitamin D is so low? And so that really, I'm a big advocate now about vitamin D and taking vitamin D, improving our health through vitamin D, and I will now tell how. Okay, so in childhood, all the development could be affected because our skeleton, kids' whole skeleton, bones, they could be affected through vitamin D deficiency, because vitamin D is very important for absorption of calcium, and both help each other build bones, teeth, and muscles contraction. Vitamin D also makes our immune system strong. And if some child is having multiple diarrhea, like symptoms of diarrhea, they please get them checked for vitamin D deficiency, because vitamin D plays a very important role in immune system. I won't go into details, but there are different type of cells, B cells, T cells, and all these cells, vitamin D really helps them mature. They are mature, and they grow, and they fight for infections, all type of infections, whether viral, bacterial, or fungal. If some child is having, or some even adult is having fungal infections or other infections, uncommon infections, please get them checked for vitamin D deficiency, because we think that we are healthy and normal, but when vitamin D, the bones start giving out vitamin D. So what happens? Our bones, they try to compensate for vitamin D deficiency levels, and they start melting. In layman term, I would say melting. We call it resorption. They start becoming weaker because they are trying to maintain a level in the blood. So initially, even if the blood will be checked, there may be normal vitamin D or calcium levels, but it is through calcium, I should say rather, but it is actually bones are making it up, and they are on behalf of bones. So For children, this is important. And then vitamin D is also considered to be a very important factor because deficiency can cause depression, stress. So depression is also could be treated. It's not a sole treatment of depression, but it could be used as an adjunct therapy, like as a supportive. If somebody is going through depression, stress, or anxiety, please start taking vitamin D levels. Start taking vitamin D in sufficient amounts. And again, your doctors are very capable. Your primary care physician, family practitioner, or internal medicine internist, they can help you determine, like through some blood tests. Then coming to post-menopausal women, premenopausal stage. So I will call women who are mature, not old, mature in 40s and 50s. Their vitamin D and calcium levels maintaining them is very important. How and what do? They can cause osteoporosis, and after menopause, women they lack estrogen, normal estrogen and progesterone hormones. And the normal function of estrogen or female hormones is also related with making bones stronger. In simple words, I would tell. I mean, I can go into medical details, but I have to make it easier.
Yeah.
So when estrogen is decreasing, ovaries are not producing enough amount of estrogen. Women in their 50s or in late 40s, they will start having a deficiency of vitamin D and then calcium, because they both go side by side. So post-menopausal or pre-menopausal. So ladies, my advice is in your 40s or in after over 35 actually. When we are over 35, start taking care of your vitamin D levels, calcium, because the bones, they should not be weaker, because when we will hit that age, mature age, menopausal age, then we could have a fracture like that, because fractures are sometimes they show that osteoporosis has grown so much. So my advice would be taking vitamin D, calcium, and magnesium, because all these three minerals are very important for bone health.
Yeah, and so I think it's such an important topic for everybody to understand. There are a few things very, very important. Is that, remember, when fracture happens or something goes wrong with that, and you have later on deficiency, and you have problem with vitamin D or so forth, it means over the years you've been really deficient. So pay attention earlier, like she said, in kids age, and that's very important. There are a lot of things kids are doing which can really make a big difference here. Their dietary habits. Everybody is into losing weight. It's great if they want to stay healthy, but remember, also vitamin deficiency happens, especially vitamin D will also teeth. So teeth, bone, hair, those are how they depend on throughout your earlier years. So a lot of people ask me, there are few risk factors. Being Asian, being Caucasians, those are big risk factors, and being skinny, and then of course they have a low density to start with, so they can lose the bone mass or very quickly. Also your activity level, so your exercise and those, and going out and bright sunshine, those are very, very important. And now with COVID, and we'll talk in another episode, but with COVID they have seen that the risk of complications were way up, people low in vitamin D.
Absolutely.
So the mortality risk was really high in those. Also important is that if they have malabsorption, then we'll talk about that. Yes. And also very, very important is get your levels checked. So the question is, you don't want to overtake too much when it's not needed, but you want to have an appropriate take of this. And absorption is very important. Also is important. Check your levels, talk to your doctor, and pay attention to your health. It's very, very important. This is an important topic, and please do not ignore. For women, it's super important because of their prenatal and natal care, and post-menopausal status. This problem can really manifest pretty quickly. And also important is taking these reflux medication. They will cause problem with magnesium and vitamin absorption. So pay attention to all those and keep healthy. And thank you for coming to our show. It was
My pleasure.
And thank you for giving us such an important topic. Very simple. And check her website, check her YouTube channel, and it's been a pleasure. Thank you for watching our show.
Thank you for having me.